Mobile County Health Department. We have, again, some updates, and then we'll answer a few questions. So just to begin, since we spoke yesterday, Mobile County Health Department has been notified of 3 additional confirmed cases of COVID-19 among Mobile County residents. We've announced those through a news release, but you might notice if you're following closely on the Alabama Department of Public Health website at alabamapublichealth.gov, they are currently only showing 3 cases for Mobile County. So there is just a little bit of a reporting lag between when we find out about the cases and when the state health department runs their twice-a-day update. So we will try to sort of close that gap to make sure going forward that we will be reporting the same number of cases. So you will not see individual news releases coming from us any further now that we have 5 cases reported in Mobile County. We feel like we'll just, going forward, just present the daily number of cases that is provided there on the Alabama Department of Public Health website. So stay tuned for that. I can mention, yesterday, the state health department, well, some days ago, the state health department began posting the number of negative tests that have been reported. And I think today the update is somewhere over 2,000 tests that have been negative tests that have results that have been received statewide. We have about 140 negative test results that we know about in Mobile County residents. And again, as we mentioned yesterday, we believe that to be an underestimation because reporting negative laboratory results is a new thing for laboratories and providers. We think that that's an underrepresentation. So, but we will begin reporting that number out to you all so that you have some idea about the number of negative test results that we have in Mobile. Let's see. I just wanted to mention the Alabama Department of Public Health has opened up a COVID-19 general information line. You may reach it at 800-270-7268. Calls are answered from 7 a.m. until 9 p.m. every day. You can reach this number. Our hotline is only open during the day. We are extending to Saturday and Sunday this week, but if you want to speak to someone after hours, you can call 1-800-270-7268 from 7 a.m. to 9 p.m. daily, and those calls are answered by folks working at the state health department. Also, to remind you, we know we have a couple of testing sites that have been announced as opened in Mobile County. Those were established by a collaboration with the Alabama Health Association and the Alabama Department of Public Health. The phone number to find those locations is 888-264-2256. The callers will be asked to give their zip code and will be routed to a location near them. Again, 888-264-2256. We really recommend contacting this number if you are looking to get tested because the locations can change daily and the availability for testing at these locations can change daily, and we are not always privy to that information at the Mobile County Health Department. Also, if you have been viewing the dashboard of cases by county on the Alabama Department of Public Health website, they also have a new tab that has the location of the testing sites, and if you hover over the little hospital sign, you'll get details on the location of that testing site, the hours of operation, what the requirements are for testing, things of that nature. So speaking of testing, let me update you on a couple of things that also have changed. Yesterday afternoon, a urgent update health alert network was issued by the state health officer, and it changed. The update changes the criteria. Sorry, I'm trying to say criteria and requirements at the same time. Changes the requirements for testing through the state public health laboratory. I think what is happening is that, previously last week they had opened up testing to allow pretty much anyone with a provider order to be tested, and turns out that only about 10 or 15% of the tests that are being conducted by the state laboratory are coming out positive, so we may be testing the wrong people. And also remember the testing supplies are in critical short supply. So in order to be tested by the Alabama Department of Public Health Bureau of Clinic Laboratories, a patient must meet the following criteria. The patient is symptomatic with at minimum measured or subjective fever or cough or shortness of breath, and the patient is hospitalized, or the patient is immunocompromised or has comorbidities, or the patient is age 65 or older, or the patient is a healthcare worker, or the patient is associated with a long-term healthcare facility. So again, the first of those bullets was a patient symptomatic with at minimum measured or subjective fever or cough or shortness of breath, and one of these other 5 situations: symptomatic and hospitalized, symptomatic and immunosuppressed or have comorbidities, symptomatic and age 65 or older, symptomatic and a healthcare worker, or symptomatic and associated with a long-term healthcare facility. So we are urging providers to follow these recommendations. If you order testing through a state public health lab, these will be required for testing, and no other testing will be provided through the state public health lab. I'm not quite sure if the commercial laboratories are going to follow suit. If you are a provider and you're sending your testing to a commercial laboratory, please check with them to see if their guidelines for testing and specimen collection have changed at all, because we want to make sure if you pull a specimen on a patient, there is a huge expectation that they're going to get a test result. We have been hearing a lot about test results being delayed. Let me just comment on that. The Mobile County Health Department cannot provide you your test result if you were not tested at the Mobile County Health Department. So if you were tested at any other provider, hospital, or urgent care, you must receive your test result from that ordering facility that took the specimen from you and submitted that test. We cannot report test results to you. That has to come from your provider, from the urgent care or the hospital or clinic that tested you. We've been getting a lot of questions about, can we help people get a test result? Why is it taking so long? There may be multiple reasons for it taking a while, but again, we cannot provide testing results for you because we don't have that information available, and you're not our patient, so we can't do that. It has to be from your provider. We have heard that there have been delays in specimen shipping. Sometimes a delay in testing once it gets at the laboratory, all kinds of things that may be contributing to delays in getting results. Also, a negative result may not be a high priority activity for some facilities that are overwhelmed with patients. So at the health department, we are doing our best to communicate with our patients who have been tested and getting results out in a timely manner. And please contact your healthcare provider, clinic, or hospital in order to receive a test result if you have been tested for the virus that causes COVID-19. Let's see, I see someone here from our WIC program who's going to just clarify a little bit of information about WIC, and then I'll provide some more updates to you for you and answer some questions. Amanda?
Good afternoon. My name is Amanda Arnold. I'm the director of the WIC program here in Mobile County. I just wanted to pass along some exciting news we got. The Alabama State WIC Department has been granted a waiver of physical presence by the USDA. So what that means for everybody out there that are our participants is that starting Monday, March the 30th, all WIC appointments will be allowed to be completed over the telephone. We're asking anyone that has a scheduled appointment to please call their normal clinic number, and you'll be routed to someone who will quote unquote talk you through your appointment. We will still be requiring the proofs that you normally have to bring: your proof of residency, your proof of income, and there was one I'm missing: income, residency, and self ID. But they're allowing us those to be emailed to us. So we have a new email address for that. So if you're one of our participants, please write this down. It's wicmchd@mchd.org. So wicmchd@mchd.org. All lowercase, no spaces. You can expect your appointment to take a little bit longer, between 45 and 60 minutes, so please be patient with us. This is a new process for all of us. If it is time for a normal pickup, just to get your benefits, if you will remember, you can do an online web class and then call our benefit pickup line at 251-694-3942, and we'll get you through that too. So starting Monday, we can do everything remotely over the phone. We'll be calling you if you have an appointment coming up to work with you on that. So thanks a lot for working with us. We've been extremely busy and consolidating our clinics, and I'm pleased to say the staff has worked their tails off, if I can say that on camera, and they are seeing as many people in half a day as we normally see in 2 to 3 days. So we're out here working for you. We're doing it as fast as we can. One thing I didn't mention is if you do have a special formula, a clinic issued formula that you pick up monthly, that will still be required for you to pick that up monthly. We will be doing that at our Cox Street WIC clinic at 248 Cox Street, just like you're doing now. We've got it all set out for the next couple of weeks. We know who's supposed to come in when you come in, so it'll be a quick, easy process, and we're doing it as fast as we can. So if y'all have any questions, feel free to call your clinic, and we'll direct you to where you need to go. All right, so Monday morning, it'll all be on the telephone. Thanks, guys.
All right, thank you, Amanda. It's yesterday as we spoke, we were still waiting on that federal guidance to sort of loosen up so that we could accommodate more people over the phone. So we're just really thrilled that we're able to do that starting on Monday. Let me talk about testing a little bit further, and this is the show and tell part of our together time today. Lots of people have been asking about the testing materials and why they're in such short demand, and why can't we get them. And I thought it might just be interesting for me to show you what it is that is in such short supply. So in order to be tested for COVID, you have to have this sterile flocked collection device. It's got some very unique characteristics about it. It has an expiration date. It comes individually packed. Let me see if I can get it open here. You may have seen some pictures online about how far this swab has to go down. These are for training, so they're already expired. Sorry. Mark's saying, don't waste valuable resources, but these have already expired, so we can't use it. So this plastic tip has this sort of bendable part to it here with this scrubby on the end. These are very technical terms, sorry about that. So this has to go in through your nose and all the way back to your nasopharynx area, which is way back here. And so then the specimen is taken, and once the specimen is collected, then you keep hearing about these collection vials and viral transport media. That's what this is. This goes in, it's cut off here, boxed up in the purple cap, and then sent refrigerated to the state lab. So this is the specimen collection device that we've been talking about, the swab and the tube with the viral transport media. These are collected in doctors' offices and hospitals and clinics, and then shipped on refrigeration to the state public health lab or to the commercial laboratory. Cold chain has to be maintained, and then once it gets to the lab, they pull this transport media and specimen out, and they test this biological specimen for the presence of the virus that causes COVID-19. So that might give you a little bit more visibility on what specimen collection looks like. I want to talk a little bit about what to do if you're sick. And during this time of year when we have seasonal influenza, seasonal flu, common colds, allergies, strep throat, all kinds of things going around, it can be a little bit difficult to know if the symptom you're experiencing could be related to coronavirus or maybe it's just related to a common cold. There are no sort of hard diagnostic lines that can be drawn, but we found a really great USA Today article that we'll make available on our Facebook site that compares allergies, colds, strep, flu, and the new coronavirus symptoms. So I want to just run through those quickly so that if you're at home wondering should you be concerned or not concerned, these things may help you out a little. So with allergies, we usually see runny nose, sneezing, red or swelling eyes, itchy eyes, maybe a tickle in your throat, an itchy nose, but you rarely have a fever when you're experiencing seasonal allergies. So again, that's kind of runny nose, sneezing, red eyes, itchy eyes. For the common cold, also you may have runny nose, sneezing. We're going to add in here a sore throat aches and pains, and maybe a mild cough, rarely fever. So the common cold, you may not have the itchy red eyes, but you will have runny nose, sneezing, sore throat, aches and pains, a mild cough, but rarely fever. So allergies and colds, usually no fever. For streptococcus, so strep throat, as it's commonly known, you will have very painful swallowing and fever. But that painful swallowing generally is not a symptom of allergies or cold or flu. That is very characteristic to strep throat. For flu, fever is common. You have a dry cough, it comes on very rapidly. We call this the acute onset of fever, dry cough, headache, sore throat, fatigue, usually severe fatigue, sometimes a runny nose, sometimes diarrhea, but you usually don't have sneezing when you have the flu. So you can think of that. With coronavirus, again, we have fever above 100 degrees and shortness of breath and dry cough. So shortness of breath is not something that you normally see with normal influenza, only if you begin to experience complications of influenza. So also with coronavirus, you may sometimes have a headache, sometimes have aches and pains, maybe some mild sneezing, some fatigue, but not as severe as the flu, and diarrhea is rare. So again, with allergies, no fever, itchy, watering eyes, runny nose, sneezing. For cold, rarely a fever. For flu, a fever is common, rapid onset, feeling very fatigued. And then for coronavirus, also fever, but shortness of breath and dry cough. So just wanted to go through those, and as I mentioned, we'll make that link available on our Facebook site so that you can go there and have those to reference. So let me check the time here. Okay, I don't want to take up too much of your time today. I need to clarify something about our prescription refill line. So I've been announcing several lines available to help both the public and our MCHD patients. Our COVID information line is 251-410-6243. That will be open 7 days a week, starting this week, and we'll be taking your questions 8 to 4:30 for anyone who has questions. If you are a MCHD patient, we have a pharmacy refill line. Now this refill line is for, maybe you need a new prescription or you're out of refills on your prescription. You can call 445-8634. 8635. If you're an MCHD patient and you just need a prescription refill, call the number on your medicine bottle to get your refill. The hotline, the pharmacy line, is only for if you've run out of refills or if you need a new prescription for something you don't currently have, like a new medicine. But generally, if you have a prescription that has refills on it, call the pharmacy that's printed on that bottle for those refills. And then again, for our MCHD patients, medical triage line at 251-690-8978. So clarification there from our pharmacy. See what else. I think that's about it. So I'm sorry. Yeah, I got them right here. Yeah, so we're gonna take a couple of questions, things that were submitted online and submitted by our colleagues and collaborators with the media. So here are a couple of questions. Do mosquitoes cause COVID-19? And the answer to that is thankfully no. It originally was an animal to human transmission, what we call that zoonotic. It does not go from mosquitoes to humans or from mosquitoes to mosquitoes. We would call that vector-borne, and thankfully we do not have vector transmission or mosquito transmission of COVID-19. Other questions, so are we, the health department, still conducting the epidemiologic work of tracking down contacts of people who test positive in an attempt to slow the spread? Absolutely. We have 5 known cases in Mobile right now. Our disease intervention specialists and district investigators are working very hard to contact all of those folks, to conduct the interviews that we need to identify close contacts, and to begin reaching out by telephone to those contacts to let them know that they have potentially been exposed to the virus that causes COVID-19, and they need to quarantine themselves for 14 days, monitor themselves twice a day for fever and every day for symptoms like cough or shortness of breath, and to contact public health immediately should they experience any of those symptoms. So we are absolutely continuing to do that. The follow-up question was, at what point do the numbers get too big to be viable? We don't know the answer to that. Honestly, if people are doing what we're asking them to do, it could be manageable for quite some time. If you're not running about the community and you're not going to mass gatherings and you're staying at home when you're being asked to stay at home, then the contact investigation for you is much easier than if you're about town in the community and then find out that you have a fever, and now we've got to go back and find out, if you went to the bank or, to your kids' soccer game or to a wedding or to work with a lot of people in the same room, something of that nature. So if you are following the rules, it will make that contact investigation somewhat easier for public health. All right, if you are 65 and older, should you not be around others at all, even within your family? Or is the 6-foot rule sufficient? Do we plan on seeing our older, okay. So, social isolation doesn't mean total isolation. It means social distancing, having that 6 feet from someone particularly who is at high risk. So yes, I have neighbors who are over 65. This weekend, we were out in the yard working. They walked over to the edge of the yard. We had a lovely conversation, caught up on what's going on. Those sorts of things are not just allowable, but they're encouraged, because we don't want seniors and people with underlying medical conditions to feel like they're just cut off from society. What we don't want you to do is have a family reunion over your grandparents' house where you cannot maintain that 6-foot distance of isolation or quarantine that's going to protect them and keep them healthy. So just keep that in mind. Keep them indoors, run errands on their behalf. But if you want to go visit them, do so in small groups and maintain that 6-foot distance. If you have someone who, a child or an adult family member that has any type of fever or cough or shortness of breath, they should absolutely stay away. But if you have well family members and you want to visit your elderly family members, please do so with care. But yes, please, go see them safely. We want them to know that we are here for them and really trying to do what we can to help them get through this isolation. Let's see. There is a question about why is the city of Mobile, rather than the Mobile County Health Department, seemingly taking the lead on providing large-scale testing. So the Mobile County Health Department has been conducting planning for larger scale testing at an off-site location that's been pre-identified way before this happened. We've been planning that for many weeks now, but as the mayor has experienced, all of the wishes and well intentions cannot be pulled off unless we have the testing materials. And so we have not been able to announce a date that we might be able to open our facility in the same manner that we just don't know for sure yet a date that the mayor may be able to open a testing facility that he's working on. Now, having said that, we've requested materials. Everyone around town has requested materials. So if the mayor gets materials first and they need us to support their activities out there, then absolutely we're willing to work with them on that while we continue to wait for supplies to open our own testing facility that we've been planning now for several weeks. Let's see. There's a question here that says, what role does the health department play in helping private hospitals or clinics acquire testing kits? So we've talked about this through the Healthcare Coalition, that all of the hospitals and most clinics and EMS and EMA and fire and all sorts of people are engaged. And the request for testing goes through our Mobile County Emergency Management Agency to the State Emergency Management Agency to the federal government. And that process is very well defined. It's well known by the hospitals. And so that is the way they submit their request for personal protective equipment and for testing kits like we showed you today, the swab and the transport media. I see people on Facebook wearing face masks. Should I use one of these masks or buy one of these masks? In general, we have not been recommending just community donning or wearing of surgical masks or face masks or paint masks or any kind of mask if you're well. The community threat is still low in Mobile County, and as long as you maintain that 6 foot of distance, you can protect yourself from COVID-19 infection. We do not recommend that people wear masks if they're well and moving about the community. There's just really no good data or science to demonstrate that that can protect you from infection. All right, how are we doing on time, James? Okay, trying to see some of these other questions that are here. Do you support a shutdown as being proposed by several people online? Please remind everyone to eliminate non-essential travel and social gatherings. Yeah, so this must have been someone who posted on our Facebook page to keep reminding everyone that there are recommendations to avoid gatherings of 25 people or more. So please, remember not to travel to other states that might have a lot of community spread of coronavirus. Absolutely don't travel to countries that have widespread community transmission of coronavirus. Avoid social gatherings of 25 or more, or any gathering that would not facilitate the distance of 6 feet between people who are in that gathering. As far as a shutdown is concerned, these are conversations that are very complex. I am not involved in those conversations. There are conversations going on with our county health officer, the Jefferson County health officer, the governor's task force, city leaders, business leaders, politicians, because it is a multifaceted decision and has to be made with all viewpoints on the table. So I think that right now we're doing the right things by continuing to emphasize community mitigation strategies, and if we can see a slowing of spread, then I think that we can continue going perhaps without a shutdown. But if people are not heeding the advice of public health when we make pleas for following these recommendations, then you're going to see community spread continue. And if it begins to accelerate, asking people to shelter in place or stay at home or not go outside, not go to work for a period of 2 weeks or so or longer, is definitely something that is on the table for community leaders to continue. And I think, let me address one question that I've seen in the media lately that came to us by someone of our media partner, and it's very complex and I'm not going to be able to answer it in just the few minutes that we have left. It has to do with how a hospital system, how a community triages severely ill patients when there is a shortage of beds and medical equipment. So these things have been contemplated by health scholars, scientists, politicians, community leaders for many, many, many years. And most states have drafted or adopted guidelines for triaging or prioritizing patients when our hospitals are overwhelmed and they cannot provide critical medical equipment to every patient who needs it. So these are complex discussions, and I am not involved in the development of those documents, nor do I have intimate knowledge of those, but we are aware that there is conversation out there on the national stage about the sort of appropriateness of these types of guidelines and how they might impact the decisions that our hospitals have to make if our hospital system becomes overwhelmed. So just remember, when someone asks me what is the biggest thing you're worried about, it's keeping our hospitals open and keeping our critical healthcare infrastructure open, keeping our long-term healthcare facilities open so that we can care for and treat the volume of older adults or people with severely immunocompromising conditions or other medical frailties that would create them or cause them to have complications of coronavirus should they become infected. So we have to do what we can to conserve personal protective equipment, get the testing materials to the folks that need it most, protect our healthcare workforce, and try to keep those critical healthcare activities ongoing and not overwhelmed. And so that's why we're asking you to implement these mitigation strategies so that we can keep our case count low and let our hospitals do the important work that they need to do. And with that, I'll close for today, and we'll see you again tomorrow at 2:30. Thank you, everyone.